Hello all, this is Dr. Dheeraj Masapu. I'm a senior consultant in the field of neuroanesthesiology. This video is about physical medicine and rehabilitation and the scope in future. So we have Dr. Arvind with us, who has done his physical medicine rehabilitation MD from AIIMS New Delhi, and he is going to tell us the scope, subspecialties, abroad opportunities, and multiple things we are going to discuss in our channel. So welcome to the channel, Arvind. We want you to tell your story about why you chose physical medicine rehabilitation and what actually happened in the counseling time and all that.
So thank you, sir, first of all, for giving me this opportunity. So I did my MBBS from AIIMS Delhi. Then during my PG exam preparation time, NEET INI preparation time, my priority was more towards a branch with more work-life balance. So after the exam, my options were anesthesia, PMR, ophthal, subject like that. So in detail about PMR, we had a few classes in our MBBS time, but the future scope, what exactly happens when you are doing the residency, those things I inquired at that point only. So I met with some of the PGs there at that time. They guided me about the future and what all you actually study in it. So that's how I ended up taking PMR. To be honest, I didn't have much idea when I entered, but then I actually started to like the subject when I was doing my residency. And you actually deal with patients who don't have much other hope. Their medical management is over. They have some residual deficits which are stopping them from to be fully functional, and at that stage you come in and give them some hope. So, and it puts you have to put in a lot of time, effort and empathy also. So that patient interaction part also I really enjoyed. That's how I came into the field. But then the residency program as such, it was good in AIIMS, but more you will have a really good theoretical base when you are doing your residency from an institute like AIIMS. But after my residency, I had to venture out of my institute to actually know the scope, because one issue I would say is that an all-encompassing PMR residency program is not very common in India, I would say.
Okay.
One option, of course, is CMC Vellore has they cover all aspects of it.
It covers all specialties.
Yeah, all the subspecialties so to say. So other than CMC Vellore, every residency program sort of focuses on one part, and just you will get a minimum exposure so that you will become at least curious what is there. That's how after my residency I ventured outside my institute and I worked in many places. One important place was two actually. One was Counselling Hospital in Mumbai. There they deal with the cases in the subacute stage itself. In government setups, what is commonly seen in PMR is they take relatively more stable patients. Whereas when you are working in a corporate hospital, you are expected to take off the patient once he is medically stable, just out of ICU, in the HDU stage or in the step down ICU stage, you have to take over the cases. So those cases I got to see in Counselling. Then I got more interested in the subspecialty of neuro rehab. So there is a fellowship program in NIMHANS. Now they have started one in CMC Vellore as well on neuro rehab itself. So I did my fellowship in NIMHANS in neuro rehab, wherein I got more exposure in the neurological cases. Of course, we have seen spinal cord injury, traumatic brain injury and all, but more in depth into it, myopathy cases, neuropathy cases, many rare cases we used to see in NIMHANS. That will give us a better perspective of the whole neurological process. So that was really interesting for me. And speaking of the subspecialty part, PMR of course is an N branch, but there are a lot of scope.
We'll take a break here. So basically we'll discuss about subspecialties. We'll discuss. So your story is basically you chose PMR, but that time you didn't have full idea about the subject. So guys, even if you don't know, everyone will be in the similar state actually when they're taking. So now after that physical medicine rehabilitation you have done in AIIMS, then you went to Counselling.
Yeah.
for neuro rehab training, and after that NIMANS.
Yeah.
Again for gaining experience, and now he is in a corporate hospital, he's leading a team. So that is a journey, guys, you have to understand. So we need to get exposed in different areas. He chose neuro as his specialty, that's why he is in this center where neuro is very advanced. So like that, there's so many other specialties also. Now we'll discuss about different subspecialties.
Right, sir. So I was always intrigued about the neuro part. That's why I got into neuro rehab. But another major this thing is pain medicine, wherein anesthesia also post anesthesia people pursue pain medicine. Similarly, post PMR also you can go into the pain medicine because you will have a really good understanding about the biomechanics and the muscle anatomy once you have done your PMR residency. So that will actually help you manage pain patients. Along with that, neuropathic pain also you see a lot of them. So pain medicine is very much sought after by the physiatrist groups in actually North India. I have seen that majority of them go for pain medicine only. So that is one scope. And but along with that, I should say that ultrasound guided pain interventions is a big thing nowadays. But if you are a pain physician, PMR pain physician, and you want to set up a clinic of sort, it will be difficult to procure an ultrasound machine. That issue is always there. If you are working in a hospital, that is not an issue because hospital can procure your machine. But if you are trying to set up your own center, then it will be a hurdle you have to overcome.
The hurdle, I'll tell you, it's a PNDT Act basically. Any ultrasound in the India, if you want to buy, PNDT approval you have to take, which is a very tedious process. It is not so easy. So for hospitals it is easy because they would have gone through that process, and through radiology they will take.
Right.
So for individual person it is very tough.
Yeah. So that issue is there with pain medicine, but otherwise a lot of scope is there. And another upcoming part is the sports medicine. It's not as common as in the West in India as of now, but we do have some fellowship programs like in RIMS Imphal. There is a sports medicine fellowship program that have started.
It's a 1 year or 6 months? Or
it's a 1 year thing. 1 year thing, yeah.
So what exactly they do?
Sports medicine, mainly the focus will be athletes and all who have sports related injuries. They of course require their physiotherapy part, but along with that, if you do a comprehensive rehab program where you manage the pain also, you can add some regenerative medicine, PRP injections and all. That will help in the overall process. Many times they can't go for a reconstructive surgery after a ligament injury and all. That cannot be done. So the conservative measures has to be taken care of. So in that situation, sports medicine fellowship can come in. And I believe Sports Authority of India also take people with experience in sports medicine, that I have seen their this thing. Vacancy notification wherein they consider orthopedicians, PMR physicians, and I think there is a sports medicine MD also these days, so which is very less in number, of course.
So basically that will be government job, I think so.
Yeah, Sports Authority of India is a government job, but other than that, the scope actually speaking would be you can be associated with sports teams as such. But in India as of now, it's not in that full-fledged situation, but in Europe and all they have it.
But in India, what is happening is IPL is coming. So some of the sports medicine doctors are getting jobs in IPL.
Right, sir.
And then Kabaddi league is coming. Like that, so many leagues are coming, and the viewership that they are getting is like crazy high. I know how actually it works. The viewership for all these matches are so high. So a lot of companies are putting in ads in those particular things.
Right, sir.
So a lot of business would be having going into that area. So a lot of leagues and all will come. So sports medicine, I think, will have a scope.
Yeah. So these are the main three subspecialties
in neuro, pain, sports
medicine, wherein you can actually do a fellowship and pursue it.
Okay.
Other than that, there are people who just with their experience they handle more pediatric cases. You will be seeing cerebral palsy cases where you will have to do their spasticity management, Botox injections, contracture release surgeries, orthosis, all those things come in that. There are people who handle rheumat cases a lot, wherein there will be small finger joint contractures or joint involvement which will lead to disabilities with orthosis, with surgery, with interventions, management of that. So there are people who focus on such particular disease groups also or age groups also, but no fellowship program as such is for those things.
Okay.
One more is the surgical rehab.
Okay.
So for that also I think there is a fellowship program in Mumbai. There is a All India PMR Institute in Mumbai where they mainly focus on surgical rehab itself. So they have
Post-op rehabilitation.
not post-op as such, sir, but there the main focus is actually it used to be even more important in the earlier days when there used to be polio cases.
Oh.
So they will have all sort of contractures and which need to be released. Sometime tendon lengthening, some tendon transfers need to be done.
Oh.
So originally PMR originated as a sub-branch of orthopedics. So many of our senior faculties, consultants are orthopedics. So they do all sort of tendon transfers. Even there are PMR faculties who are doing osteotomies and all for genu, valgum varum and all. So yeah, surgical rehab is another area. Even post spinal cord injury where there is not much scope of recovery, there are hand surgeries also. So there are people who do that. But one aspect some people point out is that PMR is actually a MD branch. So you are not actually it's not a MS branch, it's not a surgical branch as such. So that might create some problem in the future, some people are saying.
Got it.
But I don't think if you have an extra skill, no one is going to stop you, at least not in the private sector.
Got it.
So that is another area.
Okay, these are different areas that you can venture into after rehabilitation. Okay, I did only MD rehabilitation. See, tier 1, tier 2 towns are there. So what is the scope in each place with your...
As of now, the scope wise we are speaking, one thing is that there are a lot of aims opening up, peripheral aims, a lot of them are there now, and all of them are hiring faculties, and all of them have a PMR department, and we are not very high in number. So that is one area wherein you can go to.
Okay.
And
that's a central government job.
Central government job kind of thing.
Life settled,
Laid back life.
Yeah, laid back and settled life, yeah.
That is there. But other than that, the corporate hospitals are taking up, like our institute itself. But the corporate hospitals are generally in tier 1 cities only. And in tier 2 cities, unless there is some medical college which is there, a government setup is there, I haven't seen many PMR physicians as part of a hospital group.
Okay.
They might be having their own clinic, their own rehab center. But then that is another investment, another headache is there if you are into, it's a business, exactly. So if that situation is there, tier 2 cities, there is scope. If you have that capital, if you have that mindset, you can do that. But otherwise, as of now, tier 1 cities only have the major opportunity, and there is no lack in opportunity in tier 1 cities. That is the truth.
So it is not saturated field basically.
No, yeah. The number is very less actually compared to the demand. Actual numbers I don't actually.
I know the number. 3,000 plus people are there.
Yeah, but the demand, even in Bangalore, if you look for a job, you will get it any day. That's the situation. I get a call every other day if you are interested or not.
Got it.
Such a similar situation is there in all the metro cities. In Delhi, Mumbai. Kerala is one place where PMR is very much saturated.
In Kerala?
Yeah, so if you are a Kerala,
Bangalore, guys. Bangalore. So if you plan to stay in cities, then it's a good specialty.
Yeah, exactly.
Correct, no? So it's because a lot of surgical specialties now, it's getting saturated. So they're going to tier 2, tier 3 and all that. But if you want to be in tier 1, then PMR will be a good option. So this is about where to settle discussion. Then abroad also will settle.
Abroad, yes sir. Abroad, of course Middle East is there. There is always a high demand. Regarding PMR part, in Middle East they have large rehab facilities like 100-150 bedded rehab facilities where they need many PMR doctors. So scope is there, and you don't need to write another PLAB or USMLE exam for that. Their medical registration, basic interview and all, you can get good money again, but not much of career growth if you're looking into that part of it. Another this thing is many people go to UK. But UK actually it is in UK it is rehabilitation medicine. It's a super specialty kind of thing you do after medicine.
Okay.
So if you have already done your residency in India and then you are planning to go to UK, there are pros and cons for everything. So one issue would be you will have to put in a lot more time to get to the level you are now in India. Yeah.
Oh, okay.
As in one issue is that it's post medicine, so you have to do your residency kind of thing in medicine specialty.
Okay.
Then after that you have to work for 2-3 years more, then only you can apply for a PMR rehab medicine
Specialty register basically.
Yeah.
In anesthesia it is directly, not direct, there are also some processes there like this. So got it.
But yeah, it's a longer road if you are comparing to India.
Yeah.
But of course, the residency program in UK and all is not like India. They have more work-life balance, more. It's not that strenuous as in India. The residency is itself, so you can go for it.
They will have some European degree surely, like we have FRCA.
Yeah, but equivalent
is not there.
Not there for rehab.
Oh,
that is
so
the issue.
basically rehab is still in the evolving stage. I think there.
Maybe it has been there for a long time, but I'm not sure about FRCS or MRCS. That equivalent degree is not there for rehab.
So then other option would be Australia. Australia, I have done the research, and in I would be checking the vacancies in Australia. Rehabilitation, lot of vacancies. Actually, they want specialists like neuro rehabilitation expert required, this expert required. Like that, they would be putting in the
right.
So Australia, lot of demand is there.
But I believe again Australia you'll have to write their own exam and
yes, exams.
The residency program will be there again.
So according to Arvind, what he's telling is there is no need to do all that. India only vacancies are there.
Yeah.
Why not stay in India and
unless you have a personal reason to move out of India, there is enough opportunity
opportunities
here.
there.
And all kind of life. If you want a career-driven, high hectic life, that is there. If you want a government job, that is also there.
So you can lead the team in a early part of your career. In anesthesia, to lead the team nowadays, what is happening is 45-50 years is the age you require. Why it is happening is a lot of seniors would be there. So in a hierarchical way it comes, you know, it's not based on the skill or anything. So it will take a lot of time.
Here in PMR, you are expected to do that leadership early on actually. Because you have to set up the department. You have to manage a large manpower also.
Correct.
There will be a lot of therapists, like one PMR doctor and a lot of therapists. That is the usual structure. So that is expected out of you. Even if you are going into a government setup only, or if you are going into a corporate setup, that is expected. Unless there is an established center and you are joining as a junior doctor. But more opportunities are the other way.
Got it.
More vacancies are there in the to set up the department itself.
Got it. So anyways, you see in every area vacancies are there according to Dr. Arvind. So that is super. So then coming to some rough salaries, if we will discuss, because they are interested in understanding central government jobs, so they would be knowing because it's a 7th pay commission going on. So on an average, any specialty, if you get into AIIMS or anywhere, you will get the job of assistant professor to begin with. So anywhere between 1.5 to 1.6 lakhs you would get, but the salaries that they get are will have a lot of income tax cuts and all that, but still 1.5 to 2 lakhs is what they make. So slowly it will go up, but it would never cross 2.5 lakhs. So that is the range of salaries in central government. And coming to corporate structure and this one, what is the rough they can expect so that
if you are a fresh pass out itself, you can get around this 1 to 1.5 range somewhere you will get.
Okay, that's a good thing.
But if you have experience, of course, the numbers increases.
Yes.
For a central government job, you have to have at least 3-year post MD SRship experience.
Oh, then fresher can't get an assistant professor.
No, that won't be there. You have to have at least 3 years for all the INIs.
Correct.
That is the rule.
Correct. Any central government SRship is mandatory.
Yeah.
So 3 years.
3-year SRship is mandatory. For other state level colleges, only 1 year is needed. But if you are looking for INI, which is a major opportunity for PMR as of now, you need at least 3 years.
Correct. So 3 years is required. So then it is more like you start with 1.5 if you are a fresher, then with the years it will keep increasing, and after that once you enter a corporate and once you enter a bigger zone, how it works out is the revenue models would be calculated, and then it will be more like if you generate more revenue, more patients are coming to you in the OPD, more areas you are governing, bigger teams, everything, it will be a multi-dimensional thing actually when you come to the salaries in leadership roles. So that is about the salaries, but thing is guarantee job is there, and this is the kind of salary even anesthesiologists get. Even anesthesiologists also, after passing MD, between 90,000 to 1.2 lakhs is what usually will be given in any hospital, and in North India they will give little more. Between North and South there is a difference.
Yeah, that is there in PMR also.
Correct, no?
Yeah.
In North India it is more. I exactly don't know the reason.
I think more demand is there, I'm not sure.
I think demand is more. The production of doctors, somebody was recently commenting in my channel that the production of doctors is more in South India is what they are saying.
That should be true.
That
In UP, Bihar and all, if you go to tier 2 cities, they have good payment for any, not for PMR as such, but most of the specialties.
Correct. In even after doing DM in some of the specialties in anesthesia, if you go to tier 2, for example, if you go to Visakhapatnam, Vijayawada in Andhra, or you go to Mysore and other places, you get paid more than staying in cities. In cities, they expect you to grow organically stepwise, because there are a series of people sitting in front of you. So tier 2 you would usually pay more than tier 1 to begin with, but in longer run you make more in tier 1. So that is what I recommend. There is a definite difference I am seeing after 7 to 10 years of experience. So tier 2 they get saturated at one point. Okay, in tier 1 they keep going up. So that is about the so physical medicine rehabilitation. Then how is the to study? Like is it a tough subject to study?
No, I won't call it a tough subject, but you have to have a what I would say, like any residency program, there are the theoretical part, but one thing extra I would recommend you to develop is a mechanical mind to deal, especially when you are handling orthosis and all. That's part of that ortho lineage that coming into PMR. You have to have a mechanical thought process also to solve these hurdles that are coming up, which actually is a frontier of research in rehab actually.
Okay.
The technology part, robotics, all those things.
Yeah.
So you get to play with all these gadgets also. That's another fascinating part of it. But to understand that, you have to have a mechanical thought process as well. So that is there. Then of course the biomechanics, which we are not very much exposed in the MBBS part, and neurology, muscle anatomy, those kind of things are there. Basic anatomy you have to be very solid for this. Yeah, other than that, nothing very complicated or anything in rehab as such.
So basically, after discussing this 20 minutes, what I understood is work-life balance you'll have.
Yeah.
See, work-life balance, my definition is night calls are not there. See, everyone works from morning to evening, everyone will have that hardship, but after going home, you should not be disturbed.
Yes.
So, but in anesthesia, minimum 5 to 6 night duties, up to 7 to 8 in some centers would be there. So that will damage your circadian rhythm and all that. So that is not there. So in that way, rehab is scoring more than anesthesia. And salary part also, if people are less in one area, industry tends to pay more. That is a demand supply. Every math is calculated based on the demand supply. And since you get into leadership roles in the early part of your career, you will make surely more money than anesthesia and rehabilitation. So, but after 10 to 12 years of experience, all the professionals and consultants and all this would be making almost similar kind of money. But if you, in rehab, you can build OPD, which can never be done in anesthesia. So like you can build an OPD over a period of time, the people whom you treat will come to you. So that will be a parallel source of revenue for you. And again, the services that you provide for different departments will be a separate source of revenue. So in a longer run, if you have the skill of talking and all that, you will build a very good fortune in rehabilitation. So looking at all these calculations, and it would be a very good choice I am feeling. And that is the reason within 10-15,000 rehabilitation is getting over. So all the toppers are taking up rehabilitation, and the seats are also few. I think not
very much.
Not very much. So I think you guys got a very good understanding. And so to conclude, anything you want to tell the audience about rehabilitation? Most of the audience are people who are going for NEET counseling now. So any final thoughts about it?
It's a very good branch. You have good scope. But go in with that mindset. Understand what is happening rather than blindly going in expecting it's an MD branch, it will be like medicine. So have a basic understanding of what is happening and choose your residency program wisely. Wherever you are working, what kind of patients they are dealing with, what you will be doing in that residency, have an idea of that before choosing it. Otherwise, I would recommend it to anyone. Yes, that's it.
So last is the college. Basically CMC Vellore is where you get to
Yeah, that
exposure of everywhere.
in my experience, CMC Vellore has a very good residency program where you will get exposure to all aspects of it.
So that will give top.
Yeah,
First option.
but you have to consider the stipend part also.
Stipend is less.
Yeah, stipend is less in CMC Vellore, but up to you. Many people choose based on that also. That's why
I agree to that, but guys, I'll tell you my opinion. See, during the PG first 3 years, during the PG and first 3 to 5 years of your career, my personal opinion is that you have to choose the place where your skills will improve. Your money will automatically follow later on, and you have to choose a place where your skills will improve, you get a good exposure, and also good research and other elements they train you. Correct? No, that is my opinion.
That is actually true. In the long run, you have to think about
Yeah.
it. So that is one suggestion I would have. And of course, AIMS is good, but you will have to venture out and find out your niche afterwards.
Okay.
And some of the Kerala medical colleges have a good program, Calicut Medical College and all. That's the gist of it.
Okay, superb. Thank you, Dr. Arvind. Thank you for coming into channel, and this video is going to benefit thousands and thousands of people.
I hope so, sir.
Thank you.